Assalamualaikum and good afternoon, everyone. I'm Dr. Suriata Daud, Family Medicine Specialist from Klinik Kesihatan Teluk Intan. Teluk Intan is a small town with the Leaning Tower of Perak. Today, I will present my research entitled Factors Associated with Sexual Transmitted Infections Among High-Risk Patients and STI rates at Teluk Intan Health Clinic from 2014 to 2018. STI client-friendly clinic was started in 2014 with focus on high-risk groups in Hilir Perak district. The clinic was established and part of the Teluk Intan Getting to Zero projects 2020. When I began working in KK Teluk Intan in 2017 and was surprised with the small number of patients who attended this STI friendly clinic. So I want to do a research that will impact the quality of service in the STI client-friendly clinic. And I want to find the trend of STI in this Teluk Intan community. So the purpose of this study to review, to assess the factors associated with STI, because STIs is a great burden to public health. A study in the United States showed around 19 million new cases of STI each year. Study in Netherlands also showed an increasing trend of gonorrhea, while in Malaysia, history of primary contacts with female sex workers was most often reported by men seeking treatment in STI clinics. So secondly, I want to find the frequency of STI diagnosis and the trend of STI rates from 2014 to 2018. As many previous studies on this issue were conducted in all major cities of developed world. So we collected, we did a retrospective cross-sectional study, and data were obtained from patients' medical record. Convenient sampling of all consultations between 2014 to 2018 were reviewed. The inclusion criteria was patient older than 18 years. A newly created data collection sheet was designed to include demographic data and STI risk factors. Data was then transferred to SPSS spreadsheet version 23. Positive rates was calculated as number of patients with STI diagnosis per 100 consultation. That is percentages. Chi-square were used to analyze the trend and to find significant associations between patient vectors and STI diagnosis. P-value less than 0.05 was set as significant, and ethical approval were obtained, and MRRRID was also shown in the slide. These are the results. The study population, the number of patients in the study was 193. Table 1 showed comparisons between demographic data of patients with and without STI diagnosis from 2014 to 2018. The median age was 40 years. The majority of patients were Malay, between 21 to 59 years of age. Female with secondary school education, level and employed. Table 2 showed comparison between risk factors of patients with and without STI diagnosis. The highest number of STI diagnosis was syphilis. And this graph showed the trend of HIV, gonorrhea, and syphilis for the last from 2014 to 2018. The chi-square test for trend showed p-value 0.12, which was not significant. And the STI rate was 18.7%. So this study found a low number of patients who attended this STI clinic, and the overall rate was stable from 2014 to 2018 because majority of patients were brought in by volunteers from non-governmental organizations with limited resources. Several factors were found to be significantly associated with STI. There were age group, employment status, previous history of STI, high-risk behavior, condom use, and being victims of sexual abuse and physical abuse. These results were consistent with other studies. Maud et al. Also reported a stable STI positive rate between 2006 to 2013 in Netherlands, STI clinics. The limitations of this study, all the data were self-reported. This may lead to response bias. Secondly, the sample size was small. And thirdly, convenient sampling was utilized. The implications of this research to clinical practice: health workers in STI clinics in small towns like Teluk Intan should be vigilant in assessing these significant factors associated with STI, and further efforts need to be done to promote this STI clinic. In conclusion, the preventive program may need to address the factors associated with STI found in this study. The clinic and the stakeholders must review the effectiveness of the promotions of this clinic and the effectiveness of STI preventive program in the community, because this study showed no reducing trend in the rates of STI diagnosis over the study period. These are my references. Finally, I would like to thank Malaysian Director General of Health for his permission to present this research, the District Health Officer of Hilir Perak for his permission to conduct this research, and the 23rd FMS conference to allow me to present this research today. Thank you.